Hello, everybody. It's Phil Jacobus. It's October 1st. I'm here at my office in New York City. Thanks for joining us here at Healthcare Business News. Today, I have a very, very interesting interview with Richard Fabian, who is the president of Fujifilm Sonosite, and a fellow you might remember from previous interview, Diku Mandavia, who is the chief medical officer and really a very interesting fellow. Anyway, we're going to join them in a minute, but before we join them, let's take a look at several news stories that have occurred in our news today. One story here, Siemens has signed a 10-year partnership with a hospital in North Carolina. That is, I think, the trend of the future. This has happened a lot more in Europe than it has in the United States, and this means that they will be supplying I don't know, of course, all the details, but anyway, it's an interesting story. Another interesting story here for those of you who have legacy or older equipment, there's a debate about whether third parties can successfully service equipment, and Rob Kerwin, the general counsel with IMERS, has written a little piece that talks about how the adverse effect reporting now includes, is the equipment serviced by a third party, which will shed some light on whether third parties are doing a good job or not. So now let's go directly. Oh, and don't forget, sign up for our news. It's free. We cover stories every day. It's interesting. We really keep you up to date. Hello, everyone. It's Phil Jacobus. Thanks so much for joining me. And today we have a very interesting interview. Joining us today is Diku Mandavia, who's the Chief Medical Officer for Fujifilm Sonosite and the President and CEO of Fujifilm Sonosite, Mr. Rich Fabian. So Rich and Diku, thanks so much for joining us.
It's our pleasure. Thanks, Phil.
Thanks.
COVID-19 is on everyone's mind. Fast diagnosis is on everyone's mind. And some of you may remember that Diku spent some time with us before talking about how an ultrasound machine can be used to diagnose COVID, and how Dr. Sorti in Italy, where so much progress was made and such a challenge was faced, used ultrasound. We'll put a link in that interview in this story as well. But Fujifilm Sonosite has applied to and received approval from the FDA for this technology, this solution. So, Rich, tell us about that. What's involved in that sort of thing?
So we thought it was important for us to take a look and provide resources for our customers. And when you think about treating COVID-19, the use of point-of-care ultrasound is really an ideal tool. It's versatile, portable, easy to disinfect between patients, and gives a lot of information real time. But what our customers were really looking for is a guidebook and how to really focus on what's most important to them, which are their patients, and do it with the confidence and efficiency that an FDA approval would provide. So what we did is we put all of our resources together and created basically a guide for COVID-19, was able to work closely with the FDA for approval. And we're really proud to produce this document for our customers in record time.
Yes, it is record time, isn't it? Because I would think normally FDA approval takes years, and you must have done this in months.
We did, and this is a testament to the focus that we have on the health system in COVID, and working closely and together with the FDA to get this approved for patient safety and efficiency.
Now, what are some advantages there are some obvious advantages. I guess common sense tells us about bringing the machine to the patient versus taking the patient down the hall to the X-ray machine or CT scanner. But just because I'd be grateful if you'd sort of summarize those for me.
So I'll take that, Phil. Point of care technology is sort of like the Swiss Army knife in healthcare. And so you have COVID-19, which is a multi-organ disease. So how do you get the answers? How do you image a multi-organ problem? Well, guess what? Ultrasound is a phenomenal tool for that. And unfortunately, we've recognized with COVID-19, there's a lot of heart and lung involvement. So those are core applications. Of course, many of these patients are in shock and trying to find out the cause of the shock. And many of these have central venous catheters or arterial catheters. These are all guided by ultrasound. So all of these are important applications. And I think what happened in our approval is the FDA recognized that it was important to give guidance to health systems and practitioners of the important technologies and therapeutics to fight COVID-19. And that's sort of how point of care ultrasound and particularly the entire Sonosite portfolio was approved.
I see. You must have you must have done some field work in order to put together this, I'm going to call it a manual, although I'm sure that's not the right term, protocol. What sort of field work did you do to develop that protocol?
So one of the things that distinguishes Sonosite is our customer intimacy. So we were, from the early parts of the pandemic, both in China and Europe, hearing from customers exactly the value of point of care ultrasound. Side by side from that, we were watching as early release articles were coming out. And by the time we got to the sort of the middle of the pandemic, I'm not sure if you could say that, or at least a few months ago, we recognized there was a lot of evidence. And that served as really the core reference for this COVID-19 resource guide.
Now, what about time savings? Have you done any sort of studies as to how much time you save or how using point of care ultrasound versus radiology, radiographic equipment or CT? So
we have not done any studies currently right now in the middle of the pandemic. That's very hard. But what we do know from other sorts of applications that to transport a patient from the ICU to a CT scanner on a different floor and a return trip, all with life-saving equipment, that can be easily an hour, sometimes longer. So that's a huge time savings. And of course, as you mentioned earlier, about preventing infection, where you want to avoid transport of those patients, ideally.
No.
I was just going to say, plus the challenge of disinfecting a CT scanner after a COVID patient has entered the room.
So, Rich, I have a question. Tell me, from a supply chain standpoint, can you keep up with demand?
It's been a challenge. What I will say is we have, as a company, we've prioritized COVID-related orders over all others because we understand just how critical the need is to treat patients. We have seen a surge in demand, of course, with COVID-related orders. And it's been a challenge, and it's also been a challenge from our supply chain of components on a global basis, because many of the areas where we get components have been impacted by COVID. What I'll say is, on a global basis, our suppliers have been tremendous, and they understand the work that we do and how we're saving lives. And our employees have been incredible. They've been working around the clock to meet the demands of our customers. So I'm really proud of the organization and how we've stepped up as a company, but also as an industry to address this COVID need.
How many different types of probes are required to study all, just to fully diagnose COVID? Is it one
Phil,
probe? Go ahead.
Yeah, so as we know, because it's multi-organ, you're going to need a variety of transducers for sort of a whole body imaging. So at minimum, a phased array, ideally with a curvilinear, as well as a linear for more superficial structures and particularly for guiding catheters. That will allow you to do a very good assessment of thorax, of the heart and lung, and as well as the abdomen, evaluate for shock and do the critical procedures.
And I take it an ultrasound tech, an experienced ultrasound tech, doesn't require any special training to take advantage of the protocol you developed.
So I would state that COVID-19 is new to all clinicians, right? I mean, we're learning about things literally weekly, monthly. So the resource guide takes those latest findings. Like, what are the exact findings of COVID-19? Where should they pay particular attention to? So of course, experienced clinicians know how to do ultrasound, but this is a little bit more focused on how to guide them, particularly around COVID-19 care.
I see. Well, it sounds like I salute you. I take my hat off to you for coming up with the idea and also for taking the time to put together the resource guide. I'm going to stop calling it a protocol, otherwise I'll be in trouble. To put together the resource guide that helps clinicians to better diagnose COVID. And it's a great thing you've done, and I'm sure everyone in your company is proud of it. So keep up the good work. Are there any new developments that you want to share with us that are in the pipeline? Or is it a secret?
Well, we just released a very exciting product, our Sonosite PX, and it's out of the gates. It's been very successful. But I'll tell you that I think what else is exciting is just the overall, even though it's not a product, it's one of our pillars as a company, which is education. And this COVID resource guide is part of our education and making sure that not only our customers, but the entire industry has access to our education during COVID is important to us. And we recently, actually at the very beginning of COVID, took all of our educational videos that are related to lung exams, and we put those out not only behind the firewall of Sonosite, but out on YouTube for all customers to have access to our education and resources to help the industry.
So you might send us a link to that, and we'll put that in the story.
Absolutely. Happy to do it.
Well, Rich and Diku, do you have anything you'd like to add?
I would just say that the Sonosite team has been extremely committed to this pandemic. It's been complicated, right? As Rich said, producing our devices, but every week we get letters and emails from customers literally around the world. And that's really satisfying, right? Because what drives us really is patient care and patient outcomes. So we're proud to contribute to that.
Okay, well, I feel fortunate to have spent this time with you today, and I thank you very much for joining me.
Thanks, Phil.
Thank you.